Brooke Shields was born on May 31st, 1965 in New York City. Shields' parents divorced several months after she was born, which could have distorted her image of parenthood and marriage as a young girl. Shields has also been in the public spotlight since she was young, appearing in commercials from the age of 11 months old. When asked to describe her childhood, Shields states, "I don't think I ever really was a child. I was made into a sort of icon of sexuality." By adolescence, Shields was one of the most recognized and photographed teens in the world.
Growing up, Shields had an interesting relationship with her parents. She spent a significant amount of time with her mother, who was also her manager, but not as much time was spent with her father. Details of Shields' relationship with her father are vague. However, her relationship with her mother was highly publicized. From the start, Shields' mother, Terry, was a driving force behind her career. Terry pushed her daughter into the spotlight at an early age and as a result put a strain on their relationship.
As far as romance is concerned, Shields has had her fair share of experiences with dating in the Hollywood realm. In 1997, Brooke Shields married Andre Agassi, but the couple divorced 2 years later. In 2001, Shields married Chris Henchy, a television writer. The two had their first daughter, Rowan, in 2003, and their second daughter, Greer, in 2006. After Shields married Henchy, they had many failed attempts at pregnancy and in vitro fertilization. Just 3 weeks before giving birth to her daughter, Rowan, Shields lost her father to prostate cancer. During the birth, Rowan's umbilical cord was wrapped around her neck, forcing doctors to perform an emergency C-section. In the process, Shields' uterus herniated, causing her to lose a lot of blood. During the time of Rowan's birth, Shields was also still mourning the death of her former co-star and best friend David Strickland, who committed suicide. In addition to these stressors, the strain of a highly publicized divorce, on and off problems with her mother, a family history of depression, and a miscarriage all contributed to a difficult period in Shields' life.
After giving birth to her daughter, Rowan, Shields began to experience abnormal feelings toward the newborn baby and also began showing symptoms of depression. Shields was unable to form a bond with her daughter and had thoughts of jumping from a window and seeing her baby thrown vigorously against a wall then sliding down it. She found herself crying more than Rowan did, and she was plagued by feelings of self-doubt and self-harm.
The DSM defines postpartum depression as the onset of depressive symptoms within 4 weeks of childbirth. Infanticide is the most often associated with postpartum psychotic episodes, which are usually characterized by hallucinations. These hallucinations are usually auditory commands directing the mother to harm or even kill the infant. There can also be delusions that the child is possessed. According to the DSM, postpartum depression is a subcategory of major depression. The criteria for depression includes feelings of depressed mood, loss of interest, insomnia or hypersomnia, fatigue, feelings of worthlessness and guilt, and a diminished ability to think. Although these are just a few of the possible feelings, the DSM requires that at least 5 or more of the possible symptoms occur within a 2-week period.
Postpartum depression affects 1 in every 10 mothers within 6 months of delivery. Once a woman has had a postpartum episode, the risk of future reoccurrence increases by 30 to 50%. Risk factors for postpartum depression include pregnancy, miscarriage, weaning from breastfeeding, history of mood disorders, severe premenstrual syndrome, non-supportive partner or family, stress, bipolar disorder, insufficient rest, or a cesarean delivery.
When someone said to me postpartum depression, I said, no, those are the women that you hear about in the news that do terrible things to their kids. That's not me.
Shields' diagnosis of postpartum depression is correct. Several of the risk factors associated with postpartum depression were present in Shields' case of the disorder. She had many failed attempts at getting pregnant, as well as failed attempts at in vitro fertilization. The damage done to her cervix, the miscarriage, and the emergency C-section were all factors as well. In addition, her stressful and public relationship with her mother and the recent deaths of her father and best friend also added to stress in Shields' life early as a mother. Shields displayed a majority of the characteristics described by the DSM, such as feelings of worthlessness, extreme sadness, disconnect, fatigue, disinterest, and constant crying. In addition to these emotions Shields displayed, she also had recurring thoughts of harming herself and the baby. This form of hallucination is common occurrence in severe forms of postpartum depression. The combination of life stressors and postnatal characteristics serve as evidence that Brooke Shields suffered from postpartum depression.
We believe that Shields' choice to use a combination of antidepressants and therapy was the best treatment method. Shields began taking the antidepressant Paxil and attending regular therapy sessions. Although it was not disclosed to the public, we believe that Shields used cognitive behavioral therapy. Although she experienced a tough time, she got plenty of rest, continued to attend therapy sessions, and received full support from her family and friends. Each aspect of therapy proved to be effective on more than just one surface. The combination of all these factors led to Shields' full recovery of postpartum depression.